Welcome everyone to the latest installment of CADCA's Research into Action webinar series. I'm Carolina Duth and I'm a member of CADCA's Evaluation and Research team. If you haven't previously participated in one of our webinars, the purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. CADCA, along with its Geographic Health Equity Alliance, are excited to offer this special edition in the webinar series on point-of-sale marketing with counter tools. CADCA's Geographic Health Equity Alliance, or GEA, is a CDC-funded national network dedicated to reducing health disparities related to tobacco and cancer. GEA's focus is on reducing geographic health disparities, which they define as the differences in health behaviors, outcomes, and policies related to where people live, work, and play. For more information about GEA and promoting health equity, visit geohealthequity.org. CounterTools is a 501c3 nonprofit organization that provides training, technical assistance, and software tools to advance place-based public health and health equity initiatives. CounterTools also manages countertobacco.org, a CDC-funded resource focused on tobacco point-of-sale history, impact, and policy solutions. I'm joined for this installment by Elizabeth Gerndt of CounterTools. She will present on the topic why point of sale matters and will teach us about the importance of implementing policies to reduce this form of marketing for tobacco products. And now I'd like to introduce our presenter. Elizabeth received her Master of Public Health from the Rollins School of Public Health at Emory University. Throughout her career, she has worked at both the state and local level to advance place-based public health and health equity through policy, system, and environmental changes. Prior to starting with CounterTools in January, Elizabeth managed food and built environments initiatives for the SNAP education program at North Carolina State University. And now I'll turn it over to Ms. Gerndt to discuss her work.
Okay, thanks, Carolina. Hey, everybody. Today, I'm going to be talking about how the retail environment and point of sale play a big role in the health of our communities. Hopefully, by the end of this webinar, we'll understand why CounterTools feels that policies and interventions that focus on the point of sale are key to decreasing tobacco use, and potentially even give you some ideas on how these same concepts might apply to the use of other substances. So to start, just a little bit of background on CounterTools. Our vision at CounterTools is for a nation where healthy living is equitable across communities and everyone has the opportunity to make healthy choices. Our work focuses on advancing place-based public health and health equity through policy systems and environmental changes. As you can see on this map, we work with a wide variety of partners, including government agencies, nonprofits, universities, educational organizations in more than 20 states across the country. We're really excited to be partnering with CADCA and its Geographic Health Equity Alliance for the opportunity to share some important resources and research with all of you today. So what is the retail environment? When I say retail environment, I'm talking about brick and mortar stores like convenience stores, gas stations, corner stores, pharmacies, bodegas. The retail environment could also include places like grocery stores, vape shops, restaurants, and bars. Today, I'll be focusing specifically on locations where tobacco products are sold, but again, the point of sale can be an important consideration for a variety of products that impact public health. Point of sale, you'll also hear me refer to that as POS throughout the presentation. That's the location where a product is available for purchase. POS marketing targets both consumers and retailers. POS promotions can include interior or exterior advertisements, price discounts, product placement strategies, incentives offered to retailers to increase in-store marketing, and several other strategies. So we're going to go ahead and do that quick poll that we mentioned. I'm interested to know how many of you are involved with public health interventions that focus on the point of sale or retail environment right now. So you'll see that poll is on the screen. We'll give you a minute to answer that. And Carrie, I'm not seeing the answers there, so if you just want to let me know when we
Yeah,
have
I think
some.
you can go ahead for another couple minutes and then circle back and I'll let you
Okay,
know what the responses are.
sure. Sounds good. Okay, so today we're going to talk about 4 reasons we know that the point of sale matters. We see these 4 primary reasons, and I'll talk through each of these in some more detail, but we'll look at industry marketing spending habits and how point of sale influences youth tobacco use, as well as quit attempts, and then also the influence of density and proximity on tobacco rates. So the first reason that we know point of sale is important is because industry spending shows us it is. We know the tobacco industry is advertising heavily. Over the years, federal regulations have limited the ability for tobacco to be advertised on television, the radio, billboards, and magazines. So what does that leave us with? The retail environment, which is why we see so much industry spending dedicated to the point of sale. In the recent years, e-cigarettes have also become a major marketing focus, and they're relying on a lot of the same advertising strategies that have proven effective with traditional cigarettes. Since 2010, e-cigarette marketing expenditures have been increasing significantly year after year, reaching at least 115 million. So on the next 2 slides, we're going to look at point of sale expenditures for cigarettes and smokeless tobacco collected by the Federal Trade Commission for the year 2018. I just wanted to mention that unfortunately, e-cigarettes have not faced the same level of federal regulation so far, so we don't have quite the same level of insight into spending in this category. But the good news is that last fall, for the first time, the FTC ordered e-cigarette companies to turn over similar sales and advertising data. So hopefully we'll be able to update these numbers to include e-cigarettes in the future. Okay, so in 2018, the tobacco industry spent $7.2 billion to advertise and promote their products in the retail environment. Remember, this number is not including e-cigarettes. So then if we also factor in price discounts and promotional allowances paid to wholesalers, not just the ones paid to retailers, this is also something that would ultimately reduce the price of products to consumers. We see that number increase even more to $9 billion a year, which makes up over 96% of the tobacco industry's total marketing budget. Then in these pie charts, you'll see the percentage of marketing expenditures focused on the point of sale by product type. So we see over 80% spending on POS for cigarettes and about 66% for smokeless tobacco. Marketing dollars that we didn't consider part of those POS categories would include things like dollars spent on direct mail, magazines, internet, or sponsorships. So then we can also look at spending broken down into these different categories. These numbers are the combined total value for both cigarettes and smokeless tobacco, again, not including e-cigarettes here. So as you can see, the majority of this money is spent on price discounts and promotional allowances in order to keep products cheap and visible at the point of sale. Price discounts is the largest expenditure category for both cigarettes and smokeless tobacco, and it has been the single largest expenditure category since 2002, comprising over 85% of industry spending. Price discounts refers to the money that tobacco companies pay to cigarette retailers or wholesalers in order to reduce the price of tobacco to consumers. So this would include things like off-invoice discounts, buy-downs, voluntary price reductions, and trade programs. So promotional allowances would be referring to money that tobacco companies pay to either cigarette retailers or wholesalers in order to facilitate the sale or placement of tobacco products. For retailers, this might look like payments for stocking, shelving, displaying, and merchandising brands, volume rebates, or incentive payments. So then we also have 2 other categories. We have POS advertisements, things like signs, functional items, shelving units. as well as coupons, that's still accounting for millions of dollars in spending by the tobacco industry, but just a lot smaller when compared with that price discount and promotional allowance category. So what is all this money buying the tobacco industry? It's buying them a lot. We know that they're buying brand recognition, brand preference, impulse purchases, fewer successful quit attempts, a perceived norm of a higher smoking prevalence, and increased initiation of tobacco use, to name a few of those things. So we also know that the way tobacco products are advertised at point of sale is definitely not an accident. We can look at this very basic marketing principle, the 4 Ps, thinking about product, price, placement, and promotion, and see how the tobacco industry is investing in each of these strategies to increase their sales. So the first being product. The industry continues to create new and innovative products that deliver nicotine. Here you'll see a couple of examples that most of us are probably pretty familiar with. And obviously something that makes these products a little unique from a marketing perspective is the addictive nature of nicotine. We also see the products themselves and their packaging serve as an opportunity for marketing at the point of sale, with colors and brand imagery chosen intentionally to appeal to certain consumer groups. Next, we can look at price. And like I've already mentioned, the tobacco industry is relying really heavily on these price discounts. This strategy allows prices to stay low enough for price-sensitive populations, groups like youth or low-income groups, so that they can continue to purchase tobacco. We'll also see discounts or promotions that give consumers an incentive to buy now and to buy more. We know that this is making a huge impact, with evidence consistently showing us that as price increases, sales decrease for both e-cigarettes and traditional tobacco products. We also know that raising the price of tobacco products can be one of the most effective strategies for reducing initiation, decreasing consumption, and increasing cessation. But the tobacco industry's price promotion and discounts can pretty quickly diminish the impact of public health policy strategies like price increases. So next we can look at placement. Despite the fact that almost every merchandiser wants their products located at checkout, the tobacco industry continues to dominate this space, something that we commonly hear referred to as the power wall. You saw that in some of the earlier photos with all the tobacco products lining the wall behind the register. In this case, every consumer who visits the store, young or old, smoker or successful quitter, is exposed to all of these advertisements for tobacco products. We also know that placement of items and advertisements are not accidental. Marketing research points to the benefits of locating products at eye level or near other desirable products for your intended consumers. So since we know the tobacco industry is certainly aware and understands and applies this research, it can be particularly concerning to see tobacco products displayed near kid-friendly items or at youth eye level, which would be about 3 feet from the ground. So lastly, we have promotion, which we can see throughout the retail environment, from things like signage on interior and the exterior of the building, branded shelving units, and then other functional items, things like places where you sign your receipt, calendars on the wall, or clocks. All of these advertisements for tobacco products can be really hard to avoid in the retail environment. Again, we know the tobacco industry is spending a ton of money to recruit new smokers and to keep current ones hooked. So often that's at a rate of nearly $1 million per hour, and the vast majority of this money is being spent in the retail environment. Understanding these marketing strategies can be really helpful in framing what potential interventions or policy changes could be beneficial. So for example, we can think about how we can regulate each of these P's that we just talked about. We can regulate the place, we can consider where tobacco products are able to be sold, things like whether or not tobacco can be sold in pharmacies. We can regulate products, product characteristics, things like whether or not flavored tobacco products can be sold. We can think about regulations to price and discounting practices, and then we can also think about how regulation of promotion is possible, how products are advertised and displayed, and where those displays are located. So the next reason we see point of sale as crucial to tobacco control is because of its role in youth initiation. CDC statistics show us that the number of youth tobacco users, primarily e-cigarette users, continues to grow, with numbers increasing by 1.5 million between 2017 and 2018. Many of these new users are likely being exposed to e-cigs at the retail store. So research also shows us that nearly half of all adolescents in the US are visiting convenience stores at least once a week, which really points out how many youth are routinely exposed to product displays and advertising for tobacco, but also for alcohol, sugar-sweetened beverages, or other unhealthy products. And then on top of this, convenience stores often have more tobacco marketing materials than other types of stores. In 2016, we saw that 7 out of 10 middle and high school students were exposed to e-cigarette advertisements in the retail setting, which was a 24% increase in youth exposure since 2014. And many people are really surprised to hear that the retail store continues to be the #1 source of e-cig advertisements for youth. So what's the impact of all this exposure? We have a lot of research showing us that this marketing is working and that youth exposure is having a major impact on youth cigarette use. So as an example, you can see some of the studies that I referenced in the slide. We have one study that is showing us that young adults who have never tried an e-cigarette before, but who are exposed to e-cigarette advertisements had greater curiosity about and were twice as likely to have tried e-cigarettes 6 months later when compared to young adults who are not exposed to e-cigarette advertisements. We also have a study out of Texas of 12 to 17-year-old students finding that students who recalled seeing e-cigarette advertisement in stores were 3 times as likely to have ever used e-cigarettes 6 months later compared to those who did not recall seeing e-cig advertisements in stores. So we can tell that there's impacts in increased curiosity, increased intention to smoke, and increased initiation. We also have an example from a Lisa Henriksen's study that specifically highlights youth cigarette initiation. This was the first longitudinal study to provide evidence that adolescent exposure to widespread cigarette advertising at the point of sale can be a risk factor for smoking initiation. So in this study, researchers found that among adolescents age 11 to 14 who had never smoked, but visited the retail store at least twice per week, 29% of those had started smoking 1 year later, compared to just 9% of kids who were visiting stores less than twice a month. Because we have studies like this one, we can now recommend shopping frequency as an appropriate and useful indicator of exposure to retail tobacco advertising. So next we can talk about how the retail environment is important for tobacco control in terms of its influence on quit attempts. I'm sure everybody can think of examples in our lives when retail marketing has played a role in encouraging us to make a purchase we might not have been intending to make. And the same can be said for tobacco purchases, unsurprisingly making quit attempts more challenging. We even see evidence in tobacco industry documents that tobacco product displays have been specifically designed to evoke impulse purchases. I think everyone can imagine how it might be extra challenging to quit in a neighborhood that looks like this one, with tobacco being advertised in every direction. Many studies point to the way that the impact of marketing on former smokers' desire to smoke And studies find that higher exposure to point of sale cigarette marketing can be associated with a lower probability of quit success. We also have recent evidence showing us that e-cigarette advertisements increase the urge to smoke a traditional cigarette among daily smokers, and it also reduces intentions to remain abstinent among former smokers. So last, we will look at density and proximity and how that can influence tobacco use. So first, to define density and proximity. Proximity is a measure of the distance to nearest retailers in an area. It can be measured in feet, miles, kilometers, and we're often thinking of proximity in terms of distance to a residence, distance to school, or even the distance between two retailers. Density, on the other hand, is going to be a measure of the concentration or clustering of retailers in a defined area. This is measured as a number per 1,000 people. So the national tobacco retailer density average in the US is 1.2 retailers per 1,000 people, as an example. And both of these concepts can help us understand the environmental and community impact of tobacco retailers. So looking at retailer proximity, we have evidence that retailer proximity, meaning how close someone lives to a tobacco retailer, is correlated with a person's ability to stay quit. So this study out of Texas shows us that if a recent quitter lives within 250 meters of a tobacco retailer, which is less than a quarter mile, his or her odds of staying quit over 6 months are half that of someone who does not live within a quarter mile of a tobacco retailer. And then we also know that having more tobacco retailers around, having a higher density, can increase tobacco use rates. We know that increased availability of tobacco products is associated with increases in both youth and adult smoking rates. We also see studies that indicate that children are more likely to smoke when they live or go to school in neighborhoods with a high density of tobacco retailers. By having this increased access and availability of tobacco products, when we have this higher density, it's really increasing that exposure to all those massive amounts of point of sale advertising that we've already talked about. Also, you can see lots of disparities in retailer density, which I'll talk about a little bit more in a minute. Two of the strategies that are really effective in impacting retailer density are licensing and zoning. I won't go into very many details on these strategies today, but we will be sure to share some resources after the webinar with more information if you're interested in learning about either of those. And then I'll also talk about a little bit about where you can find free resources on our website, countertobacco.org. So now we can look at density and proximity together, what happens when we combine both of these effects. As you might expect, schools that have multiple retailers within walking distance, so schools that are high in both density and proximity, have been found to have a higher prevalence of smoking than schools with no retailers or low density of retailers. So as an example, this slide is depicting a study of high schools in California, finding that schools with a high density, having more than 5 retailers within walking distance, which they considered to be less than half a mile, had a higher prevalence of smoking than schools with a lower density of retailers, having between 1 and 5 retailers. And then both of these prevalences were higher than schools with no retailers in walking distance. So you see that about 12% of students were smoking in the school with no retailers present compared to 13.6 and 15.1% prevalence for the low density and the high density school. So one final point about retailer density is just to highlight the fact that disparities exist in tobacco retailer density depending on community characteristics. This example looks specifically at Prince George's County and Baltimore, Maryland. And you'll see on the slide that in Baltimore, where annual income is more than $30,000 less than in Prince George's County, there are about twice as many tobacco outlets. So under 4 tobacco outlets per 1,000 people compared to almost 8 in Baltimore. Research also indicates that there's a higher density of tobacco retailers in communities with higher percentages of African Americans or higher percentages of individuals living below the poverty line. This disparity is further amplified by the fact that in low-income and minority neighborhoods, prices of tobacco products are often cheaper. And these neighborhoods also tend to have a disproportionate amount of inexpensive combustible tobacco products like cigarillos, and often less prevalent amounts of products like e-cigs. So just to summarize, here's our 4 reasons again why we know that point of sale is key to reducing the use of tobacco products in your communities. We see new research emerging all of the time that's illustrating how each of these topics make the point of sale really important aspect for public health, not only for tobacco products, but a lot of these concepts, again, can also apply to other products such as alcohol, marijuana, even food. So hopefully this webinar also served as a reminder of a concept that we're really passionate about here at CounterTools, and something that I know is key to the work of the Geographic Health Equity Alliance, and that's that place matters. The examples we talked about today are just some of the many examples of how place profoundly impacts our health. We have a serious problem with health inequities based on where we live, and that's something that's becoming, unfortunately, even more obvious in the age of COVID-19. I think we can all play a really big role in continuing the conversations in our own communities and with our local decision makers about how we can work together to address some of the root causes of these inequities and hopefully ensure that all of us have the opportunity to live healthy lives. So lastly, I just want to point out countertobacco.org, which, like Carrie mentioned at the beginning of this webinar, is a project CounterTools manages supported by funds from the CDC and ChangeLab Solutions. This is a website where we have lots of free resources, evidence-based policy solutions, advocacy materials, lots of information that you're welcome to use as you work to counteract tobacco product sales and marketing at the point of sale in your own communities. We will take questions now, but my email address is also on the screen if there are questions that you have after the webinar that we don't get to today. And then I'll also have 2 of my colleagues, Molly Mayfield and Maria Julian, on the line to help me out with questions and answers as we get to those. So that is all I have, Carrie.
All right, let's get started with the question and answer session. CADCA is going to ask a few questions first, and then we'll ask all the questions from participants that you've been putting in the Q&A box. I see we've got 5 in there already, so that's great. Just keep typing them in that box and not typing them in the chat box, if you would. So keep typing your questions while I start with the questions from CADCA. The first question: what strategies do you recommend as most effective in limiting the tobacco industry's influence at point of sale?
Sure, that's a good question. I think there's no right answer for every community. The solution might look a little bit different for everyone, but we have lots of policy examples that have proven to be effective. Things like reducing or restricting the number, location density of those tobacco retail outlets, like we were just talking about. Strategies to increase the cost of tobacco products through things like minimum price laws, prohibiting price discounts. But I think that it's also important to think about how there's still opportunities for states that are preempted or communities that might not quite be ready for policy change to still impact point of sale. So there's examples that you could work on, things like educating the community or your decision makers, working on store assessments to gather some data, trying to find new ways to engage youth. Those are just some examples of how folks that are maybe not quite ready for policy change can still be involved in point of sale. Molly or Maria, do you have anything to add to that answer?
No, I think that sums it up pretty well. I guess the only other thing I'll add is just that for policies limiting the density and proximity where tobacco retailers can be located, and also for some of the pricing policies, those are really most effective when built on a tobacco retailer licensing system, so that you can keep track of who's selling tobacco, where they're selling it, and also have the ability to suspend or revoke their license to sell if they don't follow the rules. So that's also a great step to take if that's something that's not already in place in your community.
Thanks, Molly.
All right, we'll move on to the second question. CADCA's Geographic Health Equity Alliance focuses on reducing health disparities related to place. How does this information differ in rural areas where outlet density is lower?
Yeah, so the tobacco industry is still using a lot of the same strategies in rural areas, but targeting their advertising to different populations. So for example, you might see more advertisements for smokeless tobacco rather than e-cigarettes in rural areas. We also know that exposure looks a little different in rural areas. So a youth might not pass quite as many retailers on their way to school, but they might go to that same retailer more often. So, or they might purchase more from that retailer when they go at a time than folks in an urban area. So this can be important to thinking about policy strategies. For example, instead of limiting retailer density, rural areas might benefit a little bit more from something like restricting price promotions. I think that would probably be the biggest thing, is just making sure you're thinking appropriately about how to handle policy change and how policy change might impact differently in rural areas versus urban areas.
Great, now let's turn to some questions from participants. We've got 18 so far, which is great. So I'm just going to jump right in with a question from Ron. He asks, I think this is related to a slide presented earlier in the presentation. Is there a breakdown state by state of where the $7.2 billion is spent? And then he says, I'm not sure, but tobacco-free kids may have this breakdown.
Molly, do you know if the FTC reports are broken down by state?
Yeah, so the FTC reports themselves are not. Ron's right that the Campaign for Tobacco-Free Kids does have a breakdown of the total number, or the total expenditures state by state. So that's not going to be specifically at the point of sale, but as we mentioned earlier, the large majority of that spending does occur at the point of sale. So you can see the differences in tobacco industry spending state by state. It's under on the Campaign for Tobacco-Free Kids site. If you look at the toll of tobacco, they break it down state by state that way. And you'll see that so that will include things that are at the point of sale as well as at the wholesale level. And then there's other things that we mentioned in terms of newspapers, magazines, online spending as well.
And this is Maria. I added in the link for the FTC report that number came from in the chat box in case anyone wants to check that out.
And we'll also make sure that we share that with the recording of this webinar.
Great, and there's actually a follow-up to this question from Ron, and he's wondering if it's predominantly spent in certain states. Like he notes that New York and Massachusetts have among the highest cigarette prices in the country.
So that 7.2 billion is just talking about point of sale spending. It's not referring to price of cigarettes necessarily. So Molly, do you have any other insight into which states are seeing majority of this spending?
So I'm sure it does vary, of course, state by state. I don't know that it's dramatically like higher in one state than another based on population, and how many stores there are there as well for them to be spending. In New York and Massachusetts, the cigarette prices are higher largely because of higher taxes and some other minimum price laws that are in place, either statewide or in certain jurisdictions there. So that the types of policies that are in place is going to affect the tobacco industry spending, whether they may shift it to more promotional allowances instead of price discounts if there are restrictions in place. But as I said, you can look and see how the overall spending breaks down through the Campaign for Tobacco-Free Kids website.
Thank you. Maureen wants to know, does any state have statewide density laws?
Molly, I'll let you talk about that one as well.
Sure. Yeah. So there are a lot of different things that can impact density, I'll say. I think the majority of policies that we see are more at the local level, but there are some states that have policies in place that restrict where tobacco retailers can be. I think that, if I'm remembering right, I think that there are some that prohibit retailers from locating near schools. They may not be heavily enforced, or that may just be on the advertising. But I think they're probably most effective when done at the local level, just so that they can be responsive to the local context and put those limits in place in a way that also helps to reduce any disparities in density that we might see.
All right, we have a follow-up comment from Maureen, which I think is interesting. She's guessing that density will be affected by the economic fallout from COVID-19. Many stores in her area were already struggling, and they may never reopen. More and more people are ordering online. I guess, what do you think about that? Agree, disagree?
I think that's an interesting question. This is I think the effects it's probably too soon for us to know, but one interesting variable is there are very few places for people to go with such strong restrictions right now with stay-at-home orders. So I don't know if anyone is tracking the frequency of people going to convenience stores and grocery stores, but those that are still open, it's possible that they are seeing even an uptick in traffic. And regardless if the tobacco advertising is there, that is still having an impact. And I think it even has the power to impact online sales. That's something that we're interested in continuing to track too. Are youth purchasing e-cigarettes, particularly, for example, online more than in person? And we still need more data, but a recent study that we learned about that was published last year showed that the majority of youth are actually still purchasing their products in stores. But it will be interesting to see if that changes based on our current social distancing patterns.
So to follow on to that about social distancing, Jessica has a question. How do we implement point of sale interventions in this age of social distancing and stay-at-home orders?
Yeah, I think that's a really tricky thing that we've been trying to figure out with Counter Tools and the work that we do as well. We've been trying to equip the folks that we work with tools to kind of start these conversations and be considering kind of how they want to move forward after COVID-19 is kind of subsided. But this can be really challenging, and we have to do it with sensitivity, I think. We do know that tobacco is still the #1 cause of preventable death and disease. And we see things about potentially there being a connection between COVID-19 and smoking and vaping as a contributing factor. So I think hopefully we can see that public health becomes something that people see as more important as a result of this. but I don't unfortunately have a great answer with what can we do right now while we can't be, while social distancing is in place. Maria, do you have any tips for folks that want to work on point of sale right
Yeah,
now?
I'll just add that for communities who have already begun some work on point of sale strategies, if you have collected any data, we're giving a lot of tailored advice to certain communities who are in that boat. And this is a great time to look over the tobacco retailers that are in your area. One specific recommendation, if you have a list of tobacco retailers in your area that exists, this is a great time to look over that list and improve upon it. If you don't even know that baseline level of like, where are the retailers, this is a great time to be doing that legwork, whether it's maybe cruising around, keeping your social distance, and building your list. But that's a great place to start if you're interested in data collection. And this is, in general, we think a great time to be planning for when that changes. We have been providing social distancing recommendations for a few places that are still moving forward with modified data collection. So I think it can be done, especially if you're assessing the outside storefront, outside advertisements of areas without needing to go in or necessarily touch anything.
Great. We have a question from Jacqueline. Do you have any data on how many localities presently have tobacco retailer laws and how this has affected user rates?
Do we have that on .org, Molly?
So we don't have a comprehensive list of every place across the country that has a tobacco retailer licensing law in place, but we do have some evidence on how that it does impact user rates. So one of the biggest impacts that it has, and we've seen data on this from a number of different states, is that it actually can reduce sales to minors rates. And we're starting to see some evidence that when strong retailer licensing laws are in place, so strong being meaning that they have a fee that's charged that covers the cost of administration and enforcement of the license. That's one of the biggest factors, and that there is an annual fee. When the law is strong, that we see lower rates of youth initiation of both cigarettes and cigarettes and e-cigarettes. So that's really exciting to start to see some evaluation data come out comparing places that have tobacco retailer licensing in place, those that have a strong law, and then those that don't have it in place or have a relatively weak law in place.
Thank you. Now we have a question from Marion. How will the federal laws on Tobacco 21 affect convenience stores? Will there need to be more monitoring of adherence to that new law?
I'll start off that question, and then I'll let Elizabeth and Molly add a lot. This will definitely impact retailers in a lot of ways. We'll just introduce this idea by saying that it is now officially illegal for any retailer. It's now a violation of federal law for any retailer to be selling nicotine or tobacco products to anyone who's under the age of 21. And that includes even if someone is in the military. So this is quite a change for a lot of retailers. And while it's immediately illegal, there's not immediate supports for communities and retailers to necessarily invest the time and money into the regulation and the oversight to enforce the law. So I'll stop there and let my colleagues add more information to that.
Yeah, I think that's good. I think what you're mentioning is just points to the importance of localities enforcing their own Tobacco 21 rules and regulations so that they can think about how they want to enforce that on the local level, since we don't have all the details in place for enforcement on the federal scale.
Next question from Angela. I think this is quite interesting. Is there any research about cessation service advertising in retail environments? Do we know if counter advertising at point of sale works?
So this is Molly. I can jump in here. So I know there's not a ton of evaluation data on this, but I know that I think it was last year, maybe the year before, the FDA was actually implementing a pilot study that had some cessation. It's called the Every Try Counts campaign, where they would put essentially cessation advertising, and specifically in retail environments. And they are doing an evaluation on that. So we'll be looking for that soon. I think, you know, having that information there sometimes can displace other advertisements, and that's certainly a benefit. I don't know if other states or localities have done specific evaluation on campaigns that have been implemented locally. I think it's something that probably is helpful to have, but in terms of bang for your buck, some of the other strategies mentioned around price or retailer density may have a larger impact, but this would certainly be a great place to start. And if this is what your locality has the capacity to take on right now.
All right, I have a question from Danielle. It's a little bit long, so it might be, if you want, maybe we can ask her to email to follow up about it. But the question is, can you explain how the coupon process works between cigarette companies and the retailer? Speaking specifically, how the coupon is placed on the product and then placed at the point of sale. Danielle in her coalition is asking a big chain retailer not to allow the 99-cent coupon to be added to e-cigarettes, but they're wondering how the process works.
So this is Molly. I can jump in here again. And I'll say that it depends a little bit as to the type of promotion, but oftentimes retailers, especially big chain retailers, have contracts with tobacco industries, with tobacco companies. So they'll be required, say, for a certain quarter to sell a product that is, that the industry will come in and tell them that, okay, Marlboro cigarettes are going to be $1 off for this quarter. And the retailers, if they sell a certain amount, will get reimbursed later. That's something that's called kind of a buy down. So there are a number of different strategies that the tobacco companies will put in these contracts that then obligate the retailers to sell a certain amount, or have these contracts often also require the retailers to display products in a certain way. So I think the ask probably there, if you're working with the retailers, is going to be for them to try to refuse that part that's in their contract. But if they're looking at an individual retailer, it may be out of their hands if it's something that's signed at the corporate level. But I think that's certainly something that is worth working on. Another consideration is to have that be something that you're working towards implementing as a policy that then the local retailers would have to comply with. So if there's a conflict between what the tobacco companies want them to do and the local law, then they have to comply with the local law that says that there can be no price discounts on any sort of tobacco product.
Thank you. I think there's two questions on this general topic, so I'm going to ask one of them from Heather. Any preliminary information about an increase of tobacco purchases online due to stay-at-home orders?
I think that's what Maria was just talking about, how we just don't quite have that data yet. So we'll have to wait and see the outcome of that. Prior to this, we knew that youth were still purchasing e-cigarette, or still purchasing more products at the retail, in the retail environment than online, but we haven't been able to see how this has changed yet.
Great. I think this may be a follow-up question from Jessica on the earlier question. Or it could be another Jessica. We have a lot of people on this call. Do we have data collected by insurance companies that provided the benefit of going to smoking cessation classes to avoid additional fees, as well as the success rates of this cessation strategy?
I don't think I have an answer to that. Molly, do you know anything about data?
I don't, yeah, it could be, but I'm not aware of any of that research, if it is been conducted.
I do know that, and this cessation isn't necessarily our wheelhouse, but there are cost saving opportunities for employers through which they're purchasing insurance. And if through a workplace wellness program, enough of their employees opt to quit smoking or fill out an assessment that says that they do not smoke, that I know that there are cost savings for the employer, but I'm not sure. I'm sure that's a driving factor for cessation, but not aware of any further impacts of that.
All right, we have a question from Amy. Engaging folks most impacted in marginalized communities where density and proximity are often higher can be challenging because of their limited capacity to address these issues. How do you recommend public health advocates outside of low-income marginalized communities share this information in a way that is most likely to protect and make positive change in those communities?
That's a big question. I think it's always tricky to figure out how to best support marginalized communities. Ideally, being able to keep this in mind with any sort of policy that you come up with and that you support in your communities, being able to keep in mind how that's going to impact those low-income and marginalized communities is really important. I think we've seen evidence, and we talked about this a little bit with the differences between rural versus urban density. We've seen examples of how a policy can have a much less significant impact in marginalized communities. For example, a policy prohibiting pharmacies from selling tobacco products might have a bigger influence in more affluent communities as compared to those low-income communities. So just trying to understand how these policies would impact these groups is really important. Molly, do you have any other ideas there?
I mean, I think it's a challenging question. I definitely don't have the perfect answer, or I think it's going to vary what that looks like is going to vary some community by community, but definitely making sure that you're doing a lot of engagement with partners from those communities so that they're involved in part of the development of the solution for the problem, so that it's something that's going to be appropriate for that community and that they feel kind of ownership over that solution I think is really important.
And just to add on to that, a quick comment from Andrew Romero, the head of GIA at CADCA. He says that we should include marginalized communities in coalitions and in every step of the policymaking process. So I'm wondering if this question from Jeannie, if you have the answer to this on the countertobacco.org website. She asks, can you point us to studies that show the impact on smoking prevalence after a community reduced the density of tobacco retailers, rather than a comparison between different communities at one point in time?
So this, we're working towards, I think, as a field, having this data, but I don't think that we have quite that yet. So we do have data that shows differences, as Jeannie notes, between different communities that have different density rates. But as a longitudinal study, because a lot of density policies take time, number one, for the density to drop. A lot of times the policies reduce density through attrition. And then that's going to take time for us to see the impact on smoking rates, both on initiation and on current smokers. So I think that there are some studies that are ongoing that hopefully will give us that data in the future. But right now, mostly we have data that shows the impact, policy impact on density itself, and then on how density, how different density and smoking rates compare between communities. I did also want to jump back in and note back to a previous question that asked about the impact of cessation information, posting that in the retail environment. There was an evaluation done when New York City tried to implement this in, I think it was back in 2009, posting some quitline information at the point of sale, and preliminary research from that did show that after the signs were posted, adult current smokers and recent quitters actually did show an 11% increase in thinking about quitting smoking. So we do know that it has an impact, at least, on getting people to think about cessation.
Thanks for that update about cessation strategies. I actually want to circle back with a comment from Laura to when we were talking about marginalized communities. And she suggests that developing the youth voice in those marginalized communities may help.
Yeah, I think that's a great idea and one that we support for sure.
I'm pretty sure the answer to this question is to check out countertobacco.org. I don't see how it couldn't. An anonymous attendee it says, we are looking to remodel some of our tobacco policies. Are there any model city or state ordinances laws for tobacco zoning and advertising?
Yeah, I think that definitely exists. I'm sure that Molly can answer this, but I imagine we have some on countertobacco.org. I think Change Lab Solutions also often provides model policies for this type of work as well.
Yeah, absolutely. There are a few that are linked from countertobacco.org, but both Change Lab Solutions and the Public Health Law Center have some great model policies for licensing, zoning, and all sorts of different policies at the point of sale.
Great. A question from Sarah. What have you found is the best way to get local legislators to be open to conversations about point of sale? Data, graphs, any specific information that can catch their attention in particular?
Molly, I'll let you answer, or Maria, I'll let you answer that one as well.
So I think it depends on the decision-making body's perspective, and it's going to vary some by community to community, but having as local data as you can, I think is always going to be important, because they're going to care what's happening in their backyard and what's going to be most appropriate for the jurisdiction that they serve, not necessarily what's happening in a different state or a different community. So having as local data as you can is important. And I think also pairing it with some narrative about how tobacco and how specifically tobacco in the retail environment is affecting people's day-to-day lives in your community. And as much as they can hear from community members about that, and hear from community members that this is a priority that they want addressed, the more likely that they're going to be to consider it.
Molly, that's a great answer. And I just want to add that in addition to telling your story through data, I think it can be really powerful to involve youth and particular populations, people within your community who are particularly affected by tobacco use. So I think that can be a really powerful tool with decision makers, is seeing the energy behind this topic from the community.
And to add on to that, related to what you're saying about local data, Laura said that she found that the state data for Nevada as a whole is quite often influenced by what is happening in Las Vegas, which isn't necessarily what is happening in rural areas in terms of type of advertising, diversity, and locations of advertising. But the state funding is determined by state data, so it's hard for them to deal with that sometimes. So I thought that was very interesting. Let's do a few more questions before we wrap up here. We have a question from Michael. Does pursuing a local comprehensive smoke-free ordinance fit into this point of sale focus, or is that a different approach?
This is Molly. I think we would consider that a different approach, but also certainly a very worthwhile one. There are lots of different aspects of tobacco control that all fit together and help contribute to, you know, how healthy a place is. I think it's still certainly a place-based approach, but is a little bit different than focusing on the retail environment.
To jump back to the model policies question, I just noticed now a comment from Nancy that may be helpful. So she notes that many of the CADCA trainers who do the NCA and GCA have excellent examples, so perhaps we can ask them to provide some examples that we could pass on to attendees. So I think that's a great idea, Nancy. I will look into it. And then someone was following up on talking to local legislators, that question. And their question to follow up on that is, any advice for getting support from leadership for point of sale policies in a community that is extremely pro-business and typically opposes anything that would interfere with businesses?
This is Molly. Yeah, I think that's a common challenge that places face. And I'd say, I mean, in most cases, implementing something like, I think it depends on the type of point of sale policy that you're advocating for as to what approach is gonna work there. In some cases, you know, the type of policy that you may be implementing is actually gonna level the playing field for different retailers that are in the community and make it more fair for them all to do business. In some cases, you know, there's certainly data that shows that it doesn't have an adverse effect on the businesses as a whole. You know, they don't shut down, they find ways to adapt. I think there are also ways to make it a little bit more appealing just by giving the retailers time to adapt or providing them with resources to make sure that they can comply with the new policies and find time to adapt their own product supplies or what they're stocking to diversify and be able to still thrive. They certainly want to recognize that retailers are also a part of our local communities and do contribute to the local economies. So we're not trying to shut them down. We're just trying to make sure that they're also supporting the community and the community's health.
And one final question from Victoria. Could you speak to working on point of sale initiatives with retailers who have contracts with tobacco companies regarding sales, I think?
I'm going to let you answer that one too, Molly.
Yeah, sorry, can you repeat that one more time, please?
Sure. Could you speak to working on point of sale initiatives with retailers who have tobacco sales contracts?
Yeah, I mean, so I think pretty much everywhere there are retailers that have contracts with tobacco retailers. And I think that's just something that's important to acknowledge. And it is all the more reason to work on a policy level approach if you can, so that regardless of what the tobacco retailers want tobacco companies want the retailers to do in their contracts, the retailers still have to follow the local and state or federal law, whatever that may be. So I think that that's just an important factor to acknowledge in any conversation that you're having with retailers.
I'll also add to that it can be surprising, I think, how many retailers are and how willing they really are to work with coalitions. I think they want to know what the rules are and they want to remain compliant, especially with selling to minors and things like that. So if you're in a situation where your area is preempted from passing certain types of tobacco prevention or control policy, a really powerful strategy that you can still pursue no matter what is working directly with your retailers through voluntary agreements, essentially assurances of voluntary compliance, where they say, okay, we're going to work together, we're going to proactively try to hold ourselves to this standard because it's the right thing to do for our community.
Thanks. We still have some questions left, but I think we're going to have to wrap up this webinar. So I'm sorry if I didn't get to your question. These are all great questions. I'm sure if you want to ask Elizabeth any questions, she'd be happy to take emails from you following the webinar. So her email address is in the slides, and I'll be distributing the slides after the webinar, so you'll be able to get the email address there. So before we do wrap up, I want to let everyone know about the next webinar in this series. More information is probably going to be sent out about it next week, so keep your eye out. Brittany Bugbee of the University of Maryland is going to present on her recently published article, Substance Use, Academic Performance, and Academic Engagement Among High School Seniors. And it's going to be on May 12th at 2 p.m. Eastern Time. And as I just mentioned, I'm going to distribute the slides following this webinar to everyone who has participated. And that email is also going to contain a short evaluation for this webinar. So we'd love it if you could take the time to fill it out. I promise it's super short. And if you want a letter of participation, it's really important that you fill out the evaluation because you're going to see a link to download the letter on the thank you page of the evaluation. So what I'm saying is you must fill out an evaluation to get the letter. I'm also going to post the recording of the webinar and the resources that were mentioned in the presentation on the CADCA website. And that'll happen in the next week or so. So thank you to Ms. Gerndt for the wonderful presentation on your work and for your commitment to providing relevant and current material. Along with counter tools. We thank you all for participating in this webinar. And thanks to all the participants for your comments and your questions and your insights.